April is Stress Awareness Month, and many of us have been dealing with a lot of stress over the last year. Joining us now with more on stress and dealing with it is Dr. Lawrence Ferber. Dr. Ferber is a psychiatrist and the director of Behavioral Health Central Intake Services for Catholic Health. Thanks for joining us.
Thank you.
You know, we all know like a little bit of some stress in our lives is normal, but this last year was far from normal. Are you seeing more people, children and adults, with higher levels of stress?
You know, we're absolutely seeing a lot more people with more stress due to the pandemic. I can also vouch for, you know, the 6 emergency rooms that we overlook here in the Catholic Health Services, and even the patients that we see at times that are chronically ill. Those patients are also being very affected by the pandemic. So overall, the answer is yes. We're seeing a rise in stress levels with patients.
And that stress, how does that affect our health physically and emotionally?
So it's a great question. You know, there's a lot of evidence that has already previously pointed out that too much stress can increase heart disease, migraine headaches, hypertension, irritable bowel syndrome, muscle aches. Mentally and emotionally can increase anxiety and depression. There's just a huge amount. I mean, we've been studying stress for 100 years now, and good stress is okay, but when it gets to the chronic level, it's not good. It's very negative.
So when it gets to the chronic level, or even just a little bit before that, how can we manage stress? What are things that we can do to try to get it in check?
You know, practical things we can do are like exercising, eating better, really watching our intake of drugs and alcohol. And again, if we take care of ourselves, our self-caring, just doing some self-caring, the regular practical things we do for self-care, those kind of things will help us out.
You just talked about stress getting to a chronic level. When do we know that it's really bad and that we might need professional help?
Well, just think about it this way. You know, chronic stress is the fight, freeze, or run. That, you know, like let's say we're faced with a bear that we're faced with in the woods. You know, cortisol, adrenaline floods our system. Once that happens, we're able to respond much better and quicker. If that's happening all the time, then it hurts our body inside and outside. And I just think that once things start to go awry, we start forgetting things mentally. We can't concentrate. We're worried. We're overly depressed. Once that starts to affect us in any areas of our life, with our mates, work, academia, then it's time to look for some help.
You know, we obviously know thousands and thousands of people have lost loved ones. The report last week was 40,000 children have lost a parent over the last year, and that doesn't count grandparents and aunts and uncles. Could a lot of people out there be experiencing PTSD and not even know it?
There's you know, it's too soon to really know, but I do believe we're going to see a huge rise in PTSD, especially in the healthcare workers and first responders that have seen all of this for the past year. So I do believe we're going to see a huge rise in that PTSD for sure, and acute stress disorders.
And we've been talking a lot about the kids, and many of them are isolated for the last year, very frustrated with doing schoolwork at home, not seeing their friends. What should parents be doing to look out for, possible signs that their children are under too much stress or feeling too much stress?
So firstly, I would say take care of yourself as a parent. Do all the self-caring things we need to do so that we're okay. And then what you said, you know, the isolation. If we see our children doing anything that they don't normally do, isolating, not socializing, anything that's out of the normals, watching them, seeing if they're depressed, if they're watching too many video games or too much TV or exposing themselves, we need to get involved. People in general are not great communicators. Children are usually not even as good as that. So we just got to be on the lookout for anything we see that's not, normally happening with our children.
And if you are a little worried, where do you go?
Well, it's a great question, and here's your answer. So Catholic Health, Mercy Hospital actually has an outpatient program It's the Mercy Outpatient Partial Program, and that's located at 506 Stewart Avenue in Garden City. And that's one place you could absolutely get some help.
Can you also, there's telehealth going on now. Would you encourage somebody to, get a hold of your doctor through telehealth and maybe have get some advice there?
Telehealth is amazing. It's a great venue. Don't be scared of it. There's actually a lot of research on telehealth, and is it as good as being in person with the doctor or not? And what they found is it actually is as good as being from. Yeah, it's amazing. So I'd encourage anybody to reach out telehealth-wise.
That's good to hear because, right, so many people might think they don't have the time to get to the doctor, but if you're doing it from your home, the privacy of your home, it may be easier.
It's remarkable.
Dr. Ferber, I'm giving you the last word. Any advice for us just on looking for and dealing with stress in our everyday lives?
I would just say be cognizant of what's going on inside your body. Be cognizant of how you're feeling emotionally. Just be very aware of what's going on. Last words are, we're all in this together, and it is going to get better. It has been getting better, and there's a lot of I think there's a lot of positivity on the outcome. So we're looking forward to this getting back to a normal type situation.
You said it. The best last words. Thank you so much, Dr. Ferber.